Hey, this is Ansley Smith, the Nursing 5100. This is my volunteer, JJ. Today I'll be performing the abdominal assessment. I have performed an abdominal assessment prior to this exam, so for the purpose of this exam, she will remain clothed. So first I'm going to stand at the end of the bed. The patient should be supine. I'm going to notice for any asymmetry, symmetry, notice if there's any bulges, any distension, if I see anything that is abnormal, and I see none. Also, at this point, you would notice if there was any striae or discolorization, and there was none. The next part of my exam, the second part of an abdominal assessment, is to auscultate. So I'll auscultate in all four quadrants, and I will be listening for active bowel sounds to see if they're hyper or hypo. And then I will use the bell of my stethoscope to listen in the aortic, femoral, and iliacs to see if I hear any bruits, which could be a sign of an impending tumor or an aneurysm. Should try to listen in all quadrants for at least 15 seconds to appropriately be able to hear what you're looking for. For the purpose of the exam, I'll be a little bit quicker than that. Okay, that was all good. I'm going to use the bell of my stethoscope now. Okay, and there were no bruits noted. The next part of my exam, I'm going to start with some light palpation, and I'm going to do a circular motion around her abdomen area. I'm going to start in the upper right near the liver area. Most people, you should be able to feel the liver, however, according to their body size, you may or may not. So I'm going to begin that with some light palpation. And during this part of the exam, too, you should notice if there's any areas of tenderness. This is going to help you to look for any masses, anything that's abnormal. You should be able to measure the size of the liver. It's going to be anywhere from 6 to 12 centimeters. And you can feel hers. Also on the right side is where your appendix is going to be, and your gallbladder is a little bit below the liver. JJ does not have a gallbladder. Also, you can go with some deep palpation. Also doing the circular motion. Should also be paying attention to any tenderness. Okay. And the last part of my exam, I'm going to percuss. So I'll do the same circular motion. You should expect to hear a dullness over the liver area, and in the abdominal wall, you should hear tympany. Okay, everything sounds good there. Also, there are tons of maneuvers and tests that you can do. A couple that I'll throw out there for gallbladder will be your Murphy sign. You come in the abdominal area near the gallbladder, you press down and ask the patient to take a deep breath and breathe out. If there's any tenderness or pain felt, that could be a sign that they're having problems with their gallbladder. Your appendix, you can check for rebound tenderness. You can do the McBurney sign. You press and release. If they have any tenderness there, that could be a possible appendicitis. You can press against their foot, ask them to press against your hand. If there's any tenderness there, that could also be a sign. Or the obturator sign, you could take their foot and rotate it. If there's any tenderness or any pain, that could also be a sign of a pending appendicitis. And this concludes my abdominal assessment.